You may think of the suboccipital region as just the back of the head. However, there's more to it than meets the eye. This region is home to several muscles that assist in various head and neck movements, as well as the vessels and nerves that nourish them. The suboccipital region is actually a pyramid-shaped muscle compartment located inferior to the external occipital protuberance and deep to the superior part of the posterior cervical region, underlying the trapezius, sternocleidomastoid, splenius, and semispinalis capitis muscles. This region has 4 small paired muscles, of which 3 of them form the boundaries of an area known as the suboccipital triangle. Supraomedially, the suboccipital triangle is bounded by the rectus capitis posterior major muscle, supralaterally by the obliquus capitis superior muscle, and infralaterally by the obliquus capitis inferior muscle. The floor of the suboccipital triangle is formed by the posterior atlanto-occipital membrane and the posterior arch of the atlas, while its roof is formed by the semispinalis capitis muscle. The main inhabitants of the suboccipital triangle are the vertebral artery and the suboccipital nerve. Now, let's take a closer look at the muscles of the suboccipital region. There are 4 suboccipital muscles, which lie deep to the semispinalis capitis muscle. First, there's the rectus capitis posterior major, which originates on the spinous process of the axis or C2 vertebra and inserts on the lateral part of the inferior nuchal line of the occipital bone. Second, there's the rectus capitis posterior minor muscle, which originates on the posterior tubercle of the posterior arch of the atlas or C1 vertebra. Then it goes on to insert on the medial part of the inferior nuchal line of the occipital bone. Third, there's the obliquus capitis inferior, which originates on the spinous process of the axis, or C2, and inserts on the transverse process of the atlas. And finally, the obliquus capitis superior originates on the transverse process of the atlas and inserts on the occipital bone, between the superior and inferior nuchal lines. All 4 muscles are supplied by the suboccipital nerve and the vertebral artery, which lie in the central part of the suboccipital triangle. The main function of these muscles is maintaining the posture of the head, but they also assist in movements such as extension, lateral flexion, and rotation of the atlantoaxial joints. Now let's look at the nerves that provide innervation to the suboccipital muscles and the skin of the posterior cervical region. First, there's the suboccipital nerve, which is actually the posterior ramus of the C1 spinal nerve. From its origin, the suboccipital nerve travels between the cranium and the atlas until it courses within the suboccipital region alongside the vertebral artery. One thing to remember is that this nerve innervates the suboccipital muscles, but not any of the overlying skin. Next, there's the greater occipital nerve, which is a branch of the posterior ramus of spinal nerve C2. It emerges inferior to the obliquus capitis inferior muscle and then ascends to supply the skin of the posterior scalp. Then there's the lesser occipital nerve, which arises from the anterior rami of the spinal nerve C2 and C3. This nerve supplies the skin of the superior posterolateral neck and the scalp posterior to the external ear. Lastly, the posterior rami of spinal nerves C3 to C7 supply the intrinsic muscles of the back in the cervical region and the skin that covers them next to the vertebral column. Of course, the skin of the rest of the back is innervated segmentally by the posterior rami of the thoracic and lumbar spinal nerves. And now, just a quick quiz before the recap. Can you recall the 4 suboccipital muscles and the nerves in the suboccipital and posterior cervical regions? Alright, as a quick recap, the suboccipital region houses 4 muscles: rectus capitis posterior major, rectus capitis posterior minor, the obliquus capitis superior, and the obliquus capitis inferior. Now, the rectus capitis posterior major muscle, obliquus capitis superior muscle, and the obliquus capitis inferior muscle form the boundaries of an area called the suboccipital triangle. The suboccipital nerve and vertebral artery can be found within this triangle. The suboccipital nerve innervates the suboccipital muscles, and the cutaneous sensation to the entire posterior cervical region is provided by the greater occipital and lesser occipital nerves and the posterior rami of spinal nerves C3 to C7.
The vertebral column, commonly referred to as the spine or spinal column, consists of 33 vertebrae organized in 5 main regions: 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal. The vertebrae come in different shapes and sizes, and they have unique features depending on their region. Typical vertebrae have a basic structure in common, consisting of a vertebral body, a vertebral arch, and 7 processes: a spinous process, 2 transverse processes, and 2 superior and 2 inferior articular processes. The vertebral body is the thick, cylindrical anterior portion of the vertebra, which functions in supporting weight. As you move down the spine, the vertebral bodies become larger as they bear more weight. Posterior to the vertebral body, there is the vertebral arch, which consists of 2 pedicles and 2 laminae. The pedicles are short, thick processes that project posteriorly from the vertebral body to meet the laminae, which are 2 broad, flat plates of bone that unite in the midline and complete the vertebral arch. The space between the walls of the vertebral arch and the vertebral body is called the vertebral foramen, and when you stack all the foramina on top of each other, that forms the vertebral or spinal canal, which forms a protective bony case around the spinal cord. Focusing on the 7 processes of the vertebrae, first we have the spinous process, which extends posteriorly from the midline junction of the laminae and serves as an attachment site for ligaments and muscles. Next, the left and right transverse processes. They extend posterolaterally from the junctions of the pedicles and laminae, while also serving as important attachment sites for ligaments and muscles. Finally, we have the 4 articular processes. First, there's the left and right superior articular processes, which project superiorly from the junctions of the pedicles and laminae. Next are the left and right inferior articular processes, which project inferiorly from the junctions of the pedicles and laminae. The superior articular processes, inferior articular processes, along with the pedicles, the vertebral bodies, and intervertebral discs between vertebral bodies, go on to create U-shaped indentations called the superior and inferior vertebral notch. So let's look at the articulation between 2 typical vertebrae from a lateral angle. The superior and inferior articular processes of each vertebra allow articulation with adjacent vertebrae via their articular facets. The inferior articular process of the top vertebra comes into contact with the superior articular process of the bottom vertebra, forming a zygapophyseal joint, also called a facet joint. The facet joints help keep the vertebrae properly aligned, while also allowing movement of the vertebral bodies. Furthermore, their orientation differs throughout the vertebral column. This allows for different movements of the vertebral bodies in the cervical, thoracic, and lumbar regions. While still looking from a lateral view, you can also see how the inferior vertebral notch of the vertebra on top aligns with the superior vertebral notch of the vertebra below it to form a canal called the intervertebral foramen, through which the spinal nerves pass. Okay, before moving on, let's take a short break and see if you can recall the basic features of a typical vertebra. So now let's look at the common features of the typical vertebrae in each region. Cervical vertebrae can be typical or atypical. And when it comes to the cervical column, the typical vertebrae are C3, C4, C5, and C6, while the atypical vertebrae are C1, C2, and C7. The vertebral bodies of typical cervical vertebrae are smaller than the other regions, are wider from side to side, and have a concave superior surface and a convex inferior surface. The lateral edges of the superior surface of the vertebral bodies are each called the uncus of the body or the uncinate process. Now, what really makes cervical vertebrae stand out is that they have a foramen transversarium, or transverse foramen, which is an opening on each of the transverse processes. It's through these foramina that the vertebral arteries and corresponding veins pass. The lateral ends of the transverse processes have two projections, an anterior tubercle and a posterior tubercle, which are attachment sites for the levator scapulae and scalene muscles. The vertebral foramen of the cervical vertebrae is large and triangular shaped to accommodate the cervical enlargement of the spinal cord to fit through it. The facets on cervical vertebrae are nearly horizontal, and as such allow for the most movement of all vertebral regions. The superior articular facets are directed slightly supero-posteriorly, meaning the facets face up and back slightly, while the inferior articular facets are directed slightly inferiorly and anteriorly, meaning the facets face down and forward slightly. This allows adjacent cervical vertebrae to sit nicely upon each other. The main movements the facet joint allows in the cervical region are free flexion and extension, some lateral flexion, and limited rotation. The spinous process of the cervical vertebrae are short, where typically C2 through C6 are bifid, meaning they have two protrusions at the posterior end that project posterolaterally. But let's not forget about the atypical cervical vertebrae. First, the C1 vertebra, also called the atlas, is a ring-shaped bone that doesn't have a body or spinous process. So instead of a body, it has paired lateral masses that serve as a body and sustain the weight of the globe-like cranium, just like the Atlas of Greek mythology, who bore the weight of the literal world on his shoulders. The transverse processes of the atlas arise from the lateral masses, so these processes are placed more laterally than those of the inferior vertebrae. This makes the atlas the widest of the cervical vertebrae. Now, the lateral masses have two superior, concave, kidney-shaped articular surfaces. These surfaces articulate with two large cranial protuberances on either side of the foramen magnum on the occipital bone, called the occipital condyles, to form the atlanto-occipital joint. The anterior and posterior arches extend between the lateral masses and form a complete ring. The anterior arch has an anterior tubercle and a facet for the dens, and the posterior arch has a posterior tubercle and a groove for the vertebral artery. On the anterior arch, there's a tubercle for the transverse ligament. The transverse ligament extends from one lateral mass to the other lateral mass on the atlas, passing between the spinal cord and the dens, which is a part of the C2 vertebra. Speaking of which, the C2 vertebra is also called the axis because it has a blunt tooth-like dens or odontoid process. The dens projects superiorly and articulates with the posterior surface of the anterior arch of the atlas, and it's held in place by the transverse ligament. Next, C2 also has two large, flat, weight-bearing surfaces called the superior articular facets, on which the atlas rotates. It also has inferior articular processes and transverse processes similar to the other cervical vertebrae. Finally, C7 has a smaller transverse foramen than the other cervical vertebrae, and it's also called the vertebra prominens due to its long spinous process. In most people, it is the most prominent spinous process, and you can actually feel it if you run your finger and press along the midline of the back of your neck. Okay, I prominens we're done articulating the multifaceted details of the cervical vertebrae for now. Take a moment to see if you can recall the key structures of the typical and atypical cervical vertebrae. All right, next up are the thoracic vertebrae, which are located in the upper and middle back, between the cervical and lumbar vertebrae. They are intermediate in size, though they do get bigger further down the vertebral column. On a quick glance, an easy way to identify the thoracic vertebrae is from a posterior lateral view, where they look like a giraffe. This is compared to the lumbar vertebrae, which we will talk about shortly, which look like a moose. From a superior view, the typical thoracic vertebrae, which are T2 through T11, have a heart-shaped vertebral body, a vertebral foramen that is circular and small, and a pair of transverse processes that are long, strong, and extend posterolaterally. Let's look at a typical thoracic vertebra from a lateral view. The facets of the superior articular processes are nearly vertical and face posteriorly and slightly laterally, while the facets of the inferior articular processes are also nearly vertical, but face anteriorly and slightly medially. The unique orientation of the facets allows adjacent thoracic vertebrae to articulate nicely. This orientation also results in the main movement of rotation and some lateral flexion of the thoracic vertebrae. The spinous process of a typical thoracic vertebra is long and slopes postero-inferiorly, overlapping with the inferior vertebra. The most characteristic features of the thoracic vertebrae are the two superior and two inferior costal facets, which articulate with the heads of the ribs. These are known as demifacets, as they are half of a facet, with two demifacets articulating with the head of a single rib. There's also one costal facet on the anterior side of each of the transverse processes, called the transverse costal facet, which articulates with the tubercle of the ribs. And now, just a few words on the atypical thoracic vertebrae features, which are T1 and T12. T1 is similar to the C7 vertebra, so it has a long, nearly horizontal spinous process, similar to that of C7. Furthermore, the superior costal facet of T1 is a complete costal facet and not a demifacet when articulating with the first rib, where its inferior costal facet is a demifacet for the upper half of the head of the second rib. T12, on the other hand, has quite a bit in common with its downstairs neighbors, the lumbar vertebrae. Its upper half is more thoracic-like, having costal facets and articular processes that permit mainly rotational movements between it and the vertebrae above. Its lower half is more lumbar-like, with the body and pedicles being larger and thicker, as well as having a shorter, more horizontal spinous process. Furthermore, the inferior articular processes are more laterally facing, which means the movements between T12 and L1 are flexion and extension, not rotation. Since T12 is sort of caught in between the somewhat inflexible thoracic region and more flexible and mobile lumbar region, this vertebra is subject to increased transitional stress. This makes T12 the most commonly fractured vertebra. Okay, take a moment to see if you can recall the key structures of the typical and atypical thoracic vertebrae. All right, next up are the lumbar vertebrae, which are in the lower back, between the thoracic vertebrae and the sacrum. They are the largest movable vertebrae, which helps with bearing the weight of the upper body. They have a massive, thick, and strong body, which is fitting because, as we said before, from a posterior view, they look a lot like a moose, and that animal also has a massive, strong body. Typical lumbar vertebrae also have a triangle-shaped vertebral foramen, which is bigger than the thoracic vertebrae, but smaller than the cervical vertebrae. The lumbar vertebrae also have long, slender, transverse processes that extend laterally and short, broad, sturdy spinous processes. The superior articular facets are in the sagittal plane, mainly facing medially and a little posteriorly, while the inferior articular facets are also in the sagittal plane, mainly facing laterally and slightly anterior, allowing each lumbar vertebra to articulate well with the adjacent vertebrae. On the posterior surface of each of the superior articular processes There are small tubercles, called the mammillary processes, that are characteristic of lumbar vertebrae. The mammillary processes project posteriorly and allow for attachment to the multifidus and intertransversarii muscles. There's another process called the accessory process, also characteristic of lumbar vertebrae, on the posterior surface of the base of each transverse process. The accessory process provides an attachment for the intertransversarii muscles. Now let's look at an atypical lumbar vertebra. Among the lumbar vertebrae, L5 is atypical in that it is the largest of the movable vertebrae, with the most massive body and transverse processes. This is because it carries the weight of the whole upper body. Its body is also taller anteriorly. Furthermore, the facets of the L5-S1 joint are more coronal in orientation, allowing for flexion and extension, along with some lateral flexion. Okay, let's stop moosing around and pause for a quick moment to see if you can recall the key structures of the typical and atypical lumbar vertebrae. All right, now let's look at the sacral region. The sacrum is a triangular bone made up of 5 fused sacral vertebrae in adults. It's located between the lumbar vertebrae and the coccyx in the vertebral column, right between the hip bones. It stabilizes the pelvis and transfers weight to the pelvic girdle. The sacrum is thick and wide across its base, where it plays a role in weight bearing, but it tapers down inferiorly towards its apex, where it does not bear weight. From an anterior view, we can see how the sacrum resulted from the fusion of the 5 sacral vertebrae, as we notice the 4 transverse ridges that indicate the divisions between what originally was the 5 individual sacral vertebrae, S1 through S5. The wide base of the sacrum is derived from S1, and on each side it extends laterally as a wing-like structure called the ala, which is Latin for wing. The anterior lip of the body of S1 is called the sacral promontory, which marks the border of the pelvic inlet. Inferiorly, we can see 4 pairs of anterior or ventral sacral foramina that lie lateral to each vertebral body and allow for the passage of the anterior rami of sacral spinal nerves. These foramina extend to the posterior aspect of the sacrum. From a posterior aspect, they are referred to as the posterior or dorsal sacral foramina. Also in the posterior view, we can see the superior articular processes of S1 and their corresponding superior articular facets on the dorsal aspect, which articulate with the inferior articular facets of L5 at the lumbosacral angle, which can vary between 130 and 160 degrees. The lateral surfaces of the superior half of the sacrum look a bit like ears and are aptly called the auricular surfaces. These auricular surfaces articulate with the ilium to form the sacroiliac joint. In the center of the sacrum, there's the sacral canal, which is the continuation of the vertebral canal. The sacral canal contains the spinal nerve roots that make up the cauda equina, the bundle of nerves protruding from the bottom of the spinal cord. Along the midline of the posterior surface of the sacrum is the medium sacral crest, which is the remnant of the fused spinous processes of S1 to S3, or sometimes S4. The intermediate sacral crests that lie just lateral to either side of the median crests are remnants of the fused articular processes of the sacral vertebrae. Finally, the lateral sacral crests lie further laterally on each side, and they arise as a result of fusion of the transverse processes of the sacral vertebrae. Because S5 doesn't have a spinous process, nor laminae, that results in an upside-down U-shaped opening in the wall of the sacral canal, called the sacral hiatus. A bit further inferiorly, there are the sacral cornua, a pair of projections just lateral of the midline, which are remnants of the inferior articular processes of the S5 vertebra. And finally, there's the coccyx, or tailbone, which is a small, triangle-shaped bone derived from the fusion of the 4 rudimentary coccygeal vertebrae at the very bottom of the vertebral column. The anterior surface of the coccyx is smooth and slightly concave. The posterior surface is convex and has rudimentary articular processes. The coccyx serves as a site for attachment for parts of the gluteus maximus, coccygeus muscles, and the anal-coccygeal ligament. Whew, that was a lot. Take a short break and see if you can recall the key features of the sacrum and the coccyx. All right, as a quick recap, the vertebral column consists of 33 vertebrae organized into 5 regions, with 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal. Generally speaking, the vertebrae across the different regions have some key components in common, including the vertebral body, pedicles, laminae, transverse processes, articular processes, and a spinous process. Cervical vertebrae are the smallest movable vertebrae with rectangular vertebral bodies, large triangle-shaped vertebral foramen, bifid spinous processes, and a pair of transverse foramina, which are specific to the region. The atypical cervical vertebrae are C1, the atlas, C2, the axis, and C7, the vertebra prominens. Thoracic vertebrae are a bit bigger than cervical vertebrae and increase in size down the column. They look like giraffes and have a heart-shaped vertebral body, a small circular vertebral foramen, long transverse processes, downward sloping spinous processes, and costal facets on the vertebral bodies and transverse processes, which are unique to the region. The atypical thoracic vertebrae are T1 at the top of the region, which appears to be more cervical-like, and T12 at the bottom of the region, which appears to be more lumbar-like. Lumbar vertebrae are the largest and strongest movable vertebrae, which is important since they bear the most weight, and remember, they look like a moose. They have distinctly massive vertebral bodies, medium-sized triangular vertebral foramen, slender transverse processes, and mammillary processes characteristic of the region. L5 is the lone atypical lumbar vertebra, with its massive body that is taller anteriorly, accounting for the lumbosacral angle. The sacrum and coccyx are the triangle-shaped bones at the bottom of the column that form from the fusion of the individual vertebrae that make them up.
The joints of the vertebral column include the joints of the vertebral bodies, the joints of the vertebral arches, the craniovertebral joints, costovertebral joints, and the sacroiliac joints. These joints bear the body weight when sitting or standing and give us the flexibility to do the downward dog in yoga class. Let's start with the joints of the vertebral bodies, which are symphyses or secondary cartilaginous joints that aid in weight-bearing and provide strength to the vertebral column. The articulating surfaces of adjacent vertebral bodies attach to each other by fibrocartilaginous discs called intervertebral discs, or IV discs for short, in addition to numerous ligaments. The intervertebral discs function as shock absorbers between adjacent vertebrae. They also allow for limited movement between adjacent vertebrae, and while the movement between any two vertebrae is minor, the summation of those limited movements throughout the entirety of the vertebral column allow for the large movements of our spine. The intervertebral discs consist of 2 distinct parts, a thick, tough, fibrous outer ring called the annulus fibrosus, and a soft gelatinous core called the nucleus pulposus, which the annulus fibrosus surrounds. The annulus fibrosus is made up of circular layers of fibrocartilage, which allows the discs to withstand compression. Now, the nucleus pulposus provides both flexibility and resilience to the intervertebral discs, where the gelatinous core allows the discs to absorb shock when they're compressed by vertical forces. The nucleus pulposus is avascular, receiving blood via diffusion from vessels at the periphery of the annulus fibrosus and vertebral body. Now, intervertebral discs are named based on the two vertebrae they lie between. For example, the C2-C3 disc is the disc between the C2 and C3 vertebral bodies. There are 23 intervertebral discs, starting from the C2-C3 disc all the way down to the L5-S1 disc. In case you're wondering, the reason why there's no disc between C1 and C2 is that these two vertebrae form a different type of joint, called the atlantoaxial joint. Typically, the thickness of the discs increases as you go down the vertebral column. Now, there are two key ligaments that help maintain the joints of the vertebral bodies: the anterior longitudinal ligament and the posterior longitudinal ligament. The anterior longitudinal ligament is a strong, wide, fibrous band that runs down the anterior aspects of the vertebral bodies and intervertebral discs. The ligament extends from the base of the occipital bone and the C1 vertebra to the sacrum. Its main role is to prevent hyperextension of the vertebral column. The posterior longitudinal ligament is significantly more narrow, and therefore not quite as strong as its anterior counterpart. It runs within the vertebral canal along the posterior aspect of the vertebral bodies. The ligament extends from the C2 vertebra to the sacrum, and it attaches more to the intervertebral discs than to the posterior surfaces of the vertebral bodies. This ligament helps to prevent hyperflexion, and it also prevents posterior herniation or slipping of the nucleus pulposus into the vertebral canal. Okay, now let's take a deep breath and have a quick quiz. Can you identify the parts of the intervertebral disc? Next, we are going to look at the joints of the vertebral arches, which are zygapophyseal joints, also known as the facet joints. The facet joints are synovial joints between the superior and the inferior articular processes of adjacent vertebrae. They allow gliding movements of the adjacent articular processes. The type and extent of movement that occurs at the facet joints is determined by the shape and arrangement of the articular processes, which varies within different regions of the vertebral column. Each of the facet joints is surrounded by a thin joint capsule attached to the margins of the articular facets. The looser the joint capsule, the greater the mobility of the facet joint. For example, cervical joint capsules are particularly loose, making them more mobile than other facet joints. Now, as important as mobility is for the vertebral column, it is also important that the structural integrity of the vertebral column is maintained and that nothing moves too far out of place. This is where the accessory ligaments come in, namely the ligamenta flava, the interspinous and supraspinous ligaments, and the intertransverse ligaments. The ligamenta flava, plural for ligamentum flavum, are broad ligaments that extend vertically to connect the laminae of adjacent vertebrae from C2 to S1, and they help form the posterior wall of the vertebral canal. The ligamenta flava resist separation of the vertebral laminae during flexion and help maintain the normal curvature of the vertebral column. Next up are the interspinous ligaments. These are weak, thin ligaments that connect the superior and inferior surfaces of adjacent spinous processes, which help limit flexion of the vertebral column. On the other hand, the supraspinous ligaments form a strong, fibrous cord that connects the posterior tips of the spinous processes from C7 to the sacrum and also act to limit flexion of the vertebral column. Above C7, the supraspinous ligament merges with the nuchal ligament, which is a strong, thick, and broad ligament. The ligament runs along the back of the neck and extends up to the posterior aspect of the skull, limiting flexion of the head. Last but not least, the intertransverse ligaments extend vertically to connect the transverse processes of adjacent vertebrae, limiting lateral flexion of the spine. Time for another break. Let's pause and see if you can identify these ligaments. Alright, now let's get into the last group of joints of the vertebral column, the craniovertebral joints, which of course join the cranium with the vertebral column. There are two sets of craniovertebral joints, the atlanto-occipital joints and the atlanto-axial joints, both of which are synovial joints that allow for a much wider range of motion than the rest of the joints of the vertebral column. So let's break down the atlanto-occipital joints first. The term atlanto comes from atlas, which is the C1 vertebra. So, the atlanto-occipital joints are the articulation of the lateral masses of the atlas, which feature two concave superior articular surfaces with the occipital condyles, which are the convex protuberances on each side of the foramen magnum. These joints permit the flexion and extension movements when nodding yes or when headbanging at a rock concert. To help us remember the movements that occur at these joints, we can think of them as the yes joints. A small amount of lateral flexion and rotation is also permitted at these joints. Feel free to take a quick break and practice these moves to stretch your neck. The cranium and the atlas are also connected by the anterior atlanto-occipital membrane and the posterior atlanto-occipital membrane. The anterior atlanto-occipital membrane is broad and continuous with the anterior longitudinal ligament. It is made up of strong fibers that extend from the anterior arch of the atlas to the anterior margin of the foramen magnum. The posterior atlanto-occipital membrane continues with the ligamentum flavum. It's also broad, but made up of relatively thin and weak fibers that extend from the upper border of the posterior arch of the atlas to the posterior margin of the foramen magnum. Together, the anterior and posterior atlanto-occipital membranes help prevent excessive movement of the atlanto-occipital joints. Next, there are the atlanto-axial joints, which connect the C1 vertebra, or atlas, to the C2 vertebra, or axis. This is a complex joint that's actually made up of a median and two lateral synovial joints. The lateral atlanto-axial joints connect the inferior facets of the lateral masses of the atlas to the superior facets of the axis. The lateral atlanto-axial joints are plane-type synovial joints, which only allow the atlas to glide over the axis. Next is the median joint. This joint is between the anterior surface of the dens, or odontoid process, of the axis and a facet that lies on the posterior surface of the anterior arch of atlas. This unique articulation creates a pivot joint. The dens is held up against the anterior arch of the atlas by the transverse ligament of the atlas, which attaches to tubercles on the lateral masses of the atlas. Movement at all three joints permits the cranium and atlas to rotate together as a unit on axis, moving the head side to side, known as the no movement. To help us remember and distinguish these joints from the atlanto-occipital joints, we can think of the atlanto-axial joints as the no joints. Now, looking from a posterior view of the skull, we can see that from the transverse ligament of the atlas, there are a pair of weak longitudinal bands that extend vertically. The superior longitudinal band extends up to the occipital bone, and the inferior longitudinal band extends down to the body of the axis. Together, the transverse ligament of the atlas and the superior and inferior longitudinal bands are known as the cruciate ligament of the atlas, named so because of its resemblance to a cross. There's also a pair of short, fibrous cords called the alar ligaments, which extend from both sides of the dens to the lateral margins of the foramen magnum to hold the dens in place and prevent excessive rotation. Lastly, lying posterior to both the alar and cruciate ligaments is the tectorial membrane. This ligament is the strong, superior continuation of the posterior longitudinal ligament that extends from the body of the axis through the foramen magnum to the central part of the floor of the cranial cavity. This membrane contributes to the stability of the upper cervical spine by limiting flexion and rotation. At last! We are done with a bunch of cruciate information about joints. Now, joint me in taking a break to attempt to recall the important features of the craniovertebral joints. Alright, now that we have talked about the different types of joints of the vertebral column, let's take a closer look at the differences in movement at the cervical, thoracic, and lumbar regions of the vertebral column. In the cervical region, flexion, extension, lateral flexion, and rotation are all possible. This is due to the atlanto-occipital and atlanto-axial joints, along with the horizontal orientation of the articular surfaces of the facet joints, which allow for extensive gliding in all directions. Finally, the neck is relatively thin, without a bulk of tissue surrounding the vertebral column, especially when compared to the trunk. In the thoracic region, movement is mainly in the form of rotation with some lateral flexion. Flexion and extension are very limited because the facet joints are oriented in the coronal plane. Additionally, articulation with the ribs and the tissue bulk surrounding the thoracic vertebrae in the upper trunk combine to further limit the ability to flex or extend the thoracic vertebrae. Finally, the lumbar region is somewhat in between the cervical and thoracic region in terms of flexibility. Similar to the cervical region, the joints of the lumbar region allow for plenty of flexion and extension as the facet joints are oriented in the sagittal plane. However, the articulation of the facet joints in this area prevents rotation. Alright, time for another quiz before wrapping up. Can you identify each of these movements of the vertebral column? Finally, the joints of the vertebral column also give it its overall shape. Looking at it from a lateral view, we can see how the spine curves differently in different regions. The thoracic and sacral regions curve to form anterior concavities, known as kyphoses, plural for kyphosis. The thoracic and sacral curvatures are known as primary curvatures, meaning that they are retained from the original fetal curvature. The cervical and lumbar regions curve to form posterior concavities, known as lordoses, plural for lordosis. The cervical and lumbar lordoses are secondary curvatures, meaning they develop after birth as a result of extension from the flexed fetal position. The cervical lordosis develops when an infant is able to hold up their head, and the lumbar lordosis develops when the infant begins to walk. These curvatures of the vertebral column collectively make the spine more flexible and more capable of bearing weight and absorbing shock. Alright, as a quick recap, the joints of the vertebral bodies are joined by strong intervertebral discs that help to cushion and absorb shock when weight-bearing. The zygapophyseal, or facet joints, form between articular processes of adjacent vertebrae, and they allow for gliding movements. Collectively, facet joints and their orientation allow for the different types of motion throughout the spinal column. The two craniovertebral joints are the atlanto-occipital, which allows for flexion and extension, and the atlanto-axial joint, which allows for rotation. In the cervical region, flexion, extension, lateral extension, and rotation are all possible. The thoracic region mainly permits rotation. Some lateral flexion occurs, but flexion and extension are very limited. In the lumbar region, fairly extensive flexion and extension are possible, though minimal rotation can occur. Even though some regions have limited movement, the curvatures of the spine allow for ample movement of the vertebral column as a whole. The normal curvatures of the spine include the kyphoses in the thoracic and sacral regions, which are primary curvatures, and the lordoses in the cervical and lumbar regions, which are secondary curvatures.
Here at Osmosis, we support each other. We've got each other's backs. And it turns out, our backs support all of us. Let's look at the muscles of the back that help maintain our posture and also provide movements of the trunk and upper limb. The muscles of the back are divided into two major groups: the extrinsic back muscles and the intrinsic back muscles. The extrinsic back muscles include the superficial back muscles, which produce and control upper limb movements, and the intermediate back muscles, which are thought to be involved in respiratory movements. The superficial extrinsic back muscles include the trapezius, latissimus dorsi, levator scapulae, and the two rhomboids, rhomboid major and rhomboid minor. All these muscles are posterior axio-appendicular muscles, which connect the axial skeleton, primarily the vertebral column, to the superior appendicular skeleton, specifically the pectoral girdle and the humerus. The posterior axio-appendicular group is divided into two subgroups. The first subgroup consists of two superficial muscles, the trapezius and latissimus dorsi. The trapezius is a large triangular muscle that covers the posterior aspect of the neck and superior half of the back. There are two trapezius muscles in the back, which when seen together look like a trapezium. Proximally, the trapezius originates on the medial third of the superior nuchal line, the external occipital protuberance, the nuchal ligament, and the spinous processes of the C7 to T12 vertebrae. Distally, the trapezius inserts on the lateral third of the clavicle, the acromion, and the spine of the scapula. Based on the orientation of its fibers, the trapezius is divided into the descending, or superior part, the middle part, and the ascending, or inferior part. Contraction of the descending part results in elevation of the scapula, like when you're shrugging your shoulders. Contraction of the middle part retracts the scapula, and contraction of the ascending part depresses the scapula, lowering the shoulder. And finally, when the ascending and descending fibers work together, it results in upward rotation of the scapula, which causes the glenoid cavity to tilt superiorly. The trapezius is innervated by a plexus of nerves formed by the spinal accessory nerve, or cranial nerve 11, which provides motor innervation to the muscle, as well as by branches from the anterior rami of the C3 and C4 spinal nerves, which carry sensory information, specifically pain and proprioception, from the muscle. The arterial supply for the trapezius is primarily from the superficial branch of the transverse cervical artery, which arises from the thyrocervical trunk. These neurovascular structures travel through the posterior triangle and then along the deep surface of the trapezius muscle. The second superficial muscle is latissimus dorsi, which extends from the trunk to the humerus, acting directly on the glenohumeral joint and indirectly on the pectoral girdle. The latissimus dorsi originates on the iliac crest, thoracolumbar fascia, spinous processes of the inferior 6 thoracic vertebrae, and the inferior 3 or 4 ribs. Distally, the latissimus dorsi inserts on the floor of the intertubercular groove of the humerus. The latissimus dorsi is innervated by the thoracodorsal nerve, which consists of fibers from the anterior rami of C6, C7, and C8. The contraction of latissimus dorsi extends, adducts, and medially rotates the humerus, like when trying to scratch that annoying itch in the middle of your back. In fact, because it's such a powerful extensor and adductor, this muscle is used when pulling yourself up during rock climbing, chin-ups, or movements such as swimming or chopping wood. Okay, next up, we have the deep subgroup of the posterior axio-appendicular muscles, consisting of the levator scapulae and the two rhomboids. The levator scapulae is found in the neck, deep to the sternocleidomastoid and trapezius muscles. Proximally, it originates on the posterior tubercles of the transverse processes of the C1 to C4 vertebrae, and then descends to insert on the medial border of the scapula, superior to the spine of the scapula. Levator roughly translates to lifter, so when this muscle contracts, it elevates or lifts the scapula. It also fixes the scapula and holds it in place to resist downward forces, like when carrying a heavy piece of luggage up the stairs. It also produces downward rotation of the scapula, causing the glenoid cavity to tilt inferiorly. Now let's have a look at the rhomboids, which are located immediately deep to trapezius. There are two muscles, rhomboid minor and rhomboid major, where the rhomboid major muscle is found immediately below rhomboid minor. Rhomboid minor originates on the nuchal ligament and the spinous processes of the C7 and T1 vertebrae, and inserts on the medial border of the scapula at the level of the spine of the scapula. The much larger rhomboid major originates on the spinous processes of the T2 to T5 vertebrae, and inserts on the medial border of the scapula, inferior to the spine of the scapula. Rhomboid minor and major always contract together to produce retraction and downward rotation of the scapula. They also assist the serratus anterior in holding the scapula against the thoracic wall. These movements enable us to forcibly lower the arm, like when driving a stake, but not like literally driving a stake. The rhomboids and the levator scapulae are all innervated by the dorsal scapular nerve, which arises from the anterior rami of C4 and C5, with the levator scapulae also receiving branches directly from the anterior rami of the C3 and C4 spinal nerves. Now, the dorsal scapular nerve is accompanied by the dorsal scapular artery, which may arise directly from the subclavian artery or as a branch from the transverse cervical artery, in which case it is also referred to as a deep branch of the transverse cervical artery. Regardless of its origin, the artery buddies up with the dorsal scapular nerve, where they travel deep to the levator scapulae and continue deep to the rhomboids, descending parallel to the medial border of the scapula, supplying all three muscles throughout their course. Now, deep to the posterior axio-appendicular muscles are the intermediate extrinsic back muscles, which are the two thin serratus posterior muscles. On each side, there's a serratus posterior superior muscle and the serratus posterior inferior muscle. Serratus posterior superior originates from the nuchal ligament and the spinous processes of the C7 through T3 vertebrae and inserts on the superior borders of the 2nd through 5th ribs. Based on these attachments, it's thought that this muscle acts to elevate these superior ribs during inspiration, and it's innervated by the anterior rami of the T2 to T5 spinal nerves. The serratus posterior inferior originates from the spinous processes of the T11 through L2 vertebrae and inserts at the inferior borders of the 9th through 12th ribs near their angles. Based on these attachments, it's thought to depress the inferior ribs during inspiration, and it's innervated by the anterior rami of the T9 through T12 spinal nerves. Although these muscles are often designated as respiratory muscles that cause movement of the ribs, these actions are controversial, with many sources suggesting that they may function primarily in proprioception by providing sensory information about the position of the vertebral column and ribs. Okay, let's take a quick break and try to identify all the extrinsic back muscles. Now, the intrinsic back muscles, also sometimes called the deep back muscles, are actually innervated by the posterior rami of spinal nerves and function to maintain posture and control of movements of the vertebral column. They extend from the pelvis to the cranium and are enclosed by deep fascia which attaches medially to the nuchal ligament, the tips of the spinous processes of the vertebrae, the supraspinous ligament, and the median crest of the sacrum. Laterally, this fascia attaches to the cervical and lumbar transverse processes and the angles of the ribs. The portions of the deep fascia in the thoracic and lumbar regions are collectively referred to as the thoracolumbar fascia, with the fascia forming a thin covering over the intrinsic back muscles in the thoracic region and a tough, thick covering in the lumbar region. Now let's look at the three subgroups of the intrinsic back muscles. The superficial layer is composed of the splenius muscles. The intermediate layer consists of the erector spinae, and the deep layer is composed of the transversospinalis group. The superficial layer consists of the splenius cervicis and splenius capitis. They are thick, flat muscles that lie on the lateral and posterior aspects of the neck, covering and holding in position the deeper neck muscles, kind of like a bandage. Which makes sense, given that splenius comes from splenion, which means bandage in Greek. Splenius capitis originates on the nuchal ligament and the spinous processes of C7 to T4. Its fibers run superolaterally to insert on the mastoid process of the temporal bone and the lateral third of the superior nuchal line of the occipital bone. Splenius cervicis originates on the spinous processes of T3 to T6. Its fibers run superolaterally to insert on the posterior tubercles of the transverse processes of the C1 to C3 vertebrae. The splenius capitis is innervated by the posterior rami of the middle cervical spinal nerves, where the splenius cervicis is innervated by the posterior rami of the lower cervical spinal nerves. When the splenius muscles act unilaterally, they produce lateral flexion of the neck and ipsilateral rotation, or rotation of the head to the side of the contracting muscles. When contracting bilaterally, they extend the head and neck. The intermediate layer of the intrinsic back muscles includes the column-like erector spinae muscles, which lie on each side of the vertebral column between the spinous processes of the vertebrae centrally and the angle of the ribs laterally. Moving from lateral to medial, we have the iliocostalis, then longissimus, which makes up the intermediate column, and finally the spinalis. You can remember the order of the muscles from lateral to medial by the mnemonic, "I love standing." The erector spinae muscles have a common origin through a broad tendon that attaches inferiorly to the posterior part of the iliac crest, the posterior surface of the sacrum, the sacroiliac ligaments, the sacral and inferior lumbar spinous processes, and the supraspinous ligament. Each erector spinae muscle runs superiorly and is divided regionally into 3 parts based on the sites of their superior attachments. The iliocostalis muscle is divided into iliocostalis lumborum, iliocostalis thoracis, and iliocostalis cervicis, with fibers inserting on the transverse processes of the lumbar vertebrae, angles of the lower ribs, and the transverse processes of the cervical vertebrae. The longissimus muscle has thoracis, cervicis, and capitis portions that insert on the ribs between the tubercles and angles, the transverse processes of the thoracic vertebrae, transverse processes of the cervical vertebrae, and the mastoid process of the temporal bone. And finally, the spinalis muscle is the most medial erector spinae muscle, running from spinous processes to more superior spinous processes. It consists of thoracis, cervicis, and capitis portions that insert on the spinous processes in the upper thoracic region, the spinous processes in the cervical region, and to the occipital bone. However, spinalis cervicis and capitis are highly variable and may be fused with other back muscles or be absent entirely. When acting unilaterally, the erector spinae muscles laterally flex the vertebral column, but when they act bilaterally, they serve to erect the spine, hence their name. They extend the vertebral column and head, and when the back is flexed, they control movement via eccentric contraction. The deep layer of the intrinsic back muscles consists of the transversus spinalis muscle group, which consists of the semispinalis, multifidus, and rotatories. The muscles of the transversus spinalis group are named this way because they originate from the transverse processes of vertebrae and pass obliquely to insert on the spinous processes of more superior vertebrae, and thus lie in the space between the transverse processes and spinous processes. The semispinalis, named because it arises from the upper half of the spine, is the most superficial of the transversus spinalis muscles, and originates on the transverse processes of C4 to T12. Its fibers run superior-medially, spanning 4 to 6 vertebral segments to insert on the occipital bone and the spinous processes in the cervical and thoracic regions, with each of the 3 parts of the semispinalis named for its superior attachment: semispinalis capitis, semispinalis cervicis, and semispinalis thoracis. When acting bilaterally, the semispinalis serves to extend the head and the cervical and thoracic regions of the vertebral column. When acting unilaterally, it produces contralateral rotation, or rotation to the opposite side. Deep to the semispinalis, and spanning all the way from the sacrum to C2, is the multifidus muscle, which consists of many short muscular bundles, the thickest of which are in the lumbar region. The multifidus originates from the posterior sacrum, the posterior superior iliac spine of the ilium, the aponeurosis of the erector spinae, the mammillary processes of the lumbar vertebrae, the transverse processes of the thoracic vertebrae, and the articular processes of C4 to C7. The fibers run obliquely superior-medially to insert on the spinous processes located 2 to 4 segments superior to their origin. The multifidus mainly serves to stabilize vertebrae during local movements of the vertebral column. The deepest muscles of the transversus spinalis group are the rotatories, which can be subdivided based on their length into rotatories brevis and rotatories longus. While the rotatories are present in all spinal regions, they are most developed in the thoracic region. The rotatories originate from the transverse processes of vertebrae. Their fibers run superior-medially to insert on the lamina or spinous processes of the vertebra either one segment superior to the origin, which is the case for rotatories brevis, or two segments superior to the origin, which is the case for rotatories longus. Unsurprisingly, the rotatories assist with rotatory movements. Specifically, they produce contralateral rotation of the vertebral column. They also stabilize the vertebrae, assist with extension, and may be involved in proprioception. So, all the muscles of the transversospinalis group originate from the transverse processes and pass superior-medially to the spinous processes. To differentiate between them, focus on the length of the muscle fibers. The semispinalis muscle spans 4 to 6 segments. The deeper multifidus spans 2 to 4 segments. And finally, the deepest muscles, the rotatories, span 1 or 2 segments. Okay, before we recap, let's take a moment and try to recall all of the different intrinsic back muscles. Alright, as a quick recap, there are two major groups of back muscles: the extrinsic back muscles and intrinsic back muscles. The extrinsic back muscles are divided into two subgroups: the superficial extrinsic back muscles and the intermediate extrinsic back muscles. The superficial extrinsic back muscles produce and control limb movement and include the trapezius, latissimus dorsi, levator scapulae, and the rhomboids. The intermediate extrinsic back muscles include the serratus posterior superior and the serratus posterior inferior, which may play a role in respiratory movements and proprioception. The intrinsic back muscles function to maintain posture and control movement of the vertebral column, and are divided into three subgroups: superficial, intermediate, and deep. The superficial layer of intrinsic back muscles includes the splenius cervicis and the splenius capitis. The intermediate layer is made up of the erector spinae muscles, which are the iliocostalis, longissimus, and spinalis. And finally, the deep layer of intrinsic back muscles includes the transversospinalis muscle group, which consists of the semispinalis, multifidus, and rotatories muscles. The vertebral column is important for protecting the spinal cord, as well as providing structural support, flexibility, and range of motion to our bodies. To maintain all of these important functions, our vertebral column requires an adequate blood supply and innervation. Alright, let's start with the arteries of the vertebrae, which arise from various larger parent arteries depending on the level of the vertebral column. In the neck, parent arteries include the vertebral and ascending cervical arteries. In the thorax, the posterior intercostal arteries. In the abdomen, they include the subcostal and lumbar arteries. And finally, in the pelvis, parent arteries include the iliolumbar, lateral sacral, and median sacral arteries. Now, as these parent arteries cross the external surfaces of the vertebrae, they give rise to the periosteal, equatorial, and spinal branches that directly supply the vertebrae. Periosteal branches supply the periosteum, which is a dense layer of connective tissue that surrounds the vertebrae. The equatorial branches supply the vertebral bodies themselves. Spinal branches pass through the intervertebral foramina and divide into smaller anterior and posterior vertebral canal branches. Anterior vertebral canal branches follow the surface of the vertebral body anteriorly within the vertebral canal. Here, these arteries send nutrient branches that supply the red marrow of the vertebral body. Posterior vertebral canal branches follow the vertebral arch posteriorly within the vertebral canal. These branches terminate as radicular arteries that supply the nerve roots and segmental medullary arteries that supply the spinal cord. Finally, both of these branches give rise to ascending and descending branches that anastomose with spinal canal branches of adjacent levels. Venous blood drains from the vertebral column through spinal, basivertebral, and intervertebral veins. Let's start with the spinal veins, which form plexuses along the vertebral column. These plexuses include the internal vertebral or epidural venous plexuses, which lie inside the vertebral canal, or the external vertebral venous plexuses outside the vertebral canal. These plexuses communicate through the intervertebral foramina. Now, the internal vertebral venous plexuses are further divided into the anterior internal vertebral venous plexus, lying more anteriorly in the vertebral canal, and the posterior internal vertebral venous plexus, lying most posteriorly. Additionally, the internal vertebral plexus may form large longitudinal sinuses. The external vertebral venous plexuses are divided similarly, with the anterior external vertebral venous plexus lying just anterior to the vertebral bodies, and the posterior external vertebral venous plexus lying posterior to the spinous processes. Next are the large basivertebral veins, which drain the vertebral bodies. These veins emerge from the small foramina on the surfaces of the vertebral bodies and drain into both the anterior internal and anterior external vertebral venous plexuses. Finally, the intervertebral veins. These veins receive venous blood from the spinal cord and vertebral venous plexuses. Then, taking the same path as the spinal nerves, they exit the spinal canal through the intervertebral foramina, draining into the vertebral veins of the neck and the segmental veins of the trunk. Now, let's talk about nerves. The entire vertebral column is innervated by small meningeal or recurrent meningeal branches that arise from mixed spinal nerves as they exit the intervertebral foramen. The only exception to this are the facet joints. Facet joints are innervated by articular branches, which arise from the medial branches of the posterior rami of spinal nerves. The meningeal branches, which run on each side of all vertebrae, are special because they're the only nerves to arise from mixed spinal nerves before they split into the anterior and posterior rami. Most of these branches run back through the intervertebral foramen and into the vertebral canal, which explains why they're also known as the recurrent meningeal nerves, while other branches remain outside the vertebral canal. Branches that enter the canal branch off and distribute fibers to the periosteum, ligamenta flava, the posterior longitudinal ligament, spinal dura mater, blood vessels, and the posterolateral aspects of the annulus fibrosus of the intervertebral disc. Branches that remain outside the canal innervate the anterolateral aspects of the vertebral bodies and their covering periosteum, the annulus fibrosus of the intervertebral discs, as well as the anterior longitudinal ligament. Alright, as a quick recap. The vertebral column's arterial supply comes from periosteal, equatorial, and spinal branches of the major cervical and segmental arteries. Venous blood drains into the internal and external vertebral venous plexuses. The majority of the vertebral column is innervated by the recurrent meningeal nerves, with the exception of the facet joints, which are innervated by the articular branches of the medial branches of the posterior rami of spinal nerves.